Welcome everybody. Today we will learn about stomach pain and its treatment. Don't forget to like and subscribe to the channel. Stomach pain can be caused by various factors including gastrointestinal issues, such as indigestion, gas, acid reflux, irritable bowel syndrome (IBS), inflammatory bowel disease (IBD), food poisoning, and constipation. Infections caused by bacteria, viruses, or parasites such as norovirus, Helicobacter pylori H. pylori, and Salmonella. Medical conditions, such as peptic ulcers, diverticulitis, and appendicitis. Stress and anxiety. Stress and anxiety can cause changes in the digestive system and result in stomach pain. Gastrointestinal disorders, such as Crohn's disease and ulcerative colitis. Hormonal imbalances, such as menstrual cramps in women. Food intolerance or allergies, such as lactose intolerance or gluten sensitivity. Here are some ways to prevent stomach pain. Eat a healthy diet. Include plenty of fiber, fruits, and vegetables in your diet, and limit processed and fatty foods. Avoid trigger foods. Identify and avoid foods that trigger your stomach pain, such as spicy or acidic foods. Stay hydrated. Drink plenty of water to help keep your digestive system functioning smoothly. Practice stress management. Stress and anxiety can cause changes in the digestive system, so finding ways to manage stress, such as through exercise, meditation, or deep breathing, can help prevent stomach pain. Avoid overeating. Eating large meals or eating too quickly can cause discomfort and pain in the stomach. Don't eat late at night. Eating close to bedtime can cause indigestion and increase the risk of developing acid reflux. Avoid tobacco and excessive alcohol. Both of these can irritate the digestive system and cause stomach pain. Get regular exercise. Physical activity can improve digestion and prevent constipation. Treat infections promptly. If you suspect you have a foodborne illness or another infection, seek medical attention as soon as possible to prevent complications and reduce the risk of chronic stomach pain. Remember, everyone's digestive system is different, so it is important to identify what triggers your stomach pain and make changes to your diet and lifestyle accordingly. Treatment for stomach pain depends on the underlying cause. Some common treatments include over-the-counter medication. For mild indigestion or heartburn, over-the-counter antacids, such as Tums, or acid reducers, such as ranitidine, can help relieve symptoms. Prescription medication. In some cases, prescription medication may be needed to treat underlying conditions such as ulcers or GERD. Changes in diet and lifestyle. Making dietary changes, such as avoiding trigger foods and eating smaller, more frequent meals, can help reduce symptoms of some gastrointestinal disorders. Probiotics. Taking probiotics, either in supplement form or through fermented foods, can help restore the balance of good bacteria in the gut and reduce symptoms of IBS or other digestive problems. Surgery. In some cases, surgery may be necessary to treat underlying conditions such as appendicitis or inflammatory bowel disease. Antibiotics. If an infection is the cause of the stomach pain, antibiotics may be prescribed. If stomach pain is not treated, it can lead to a number of complications, including chronic pain. If the underlying cause of the stomach pain is not treated, it can lead to chronic pain and discomfort. Bleeding. Certain conditions, such as ulcers, can cause bleeding in the stomach, which can lead to anemia and other complications if left untreated. Infections. Untreated infections in the digestive system, such as H. pylori or Salmonella, can lead to more serious health problems. Inflammation and damage to the digestive system. Chronic digestive disorders, such as Crohn's disease or ulcerative colitis, can cause inflammation and damage to the digestive system if not properly treated. Dehydration. Stomach pain and nausea can make it difficult to eat and drink, leading to dehydration. Malnutrition. If the pain and discomfort associated with digestive problems make it difficult to eat, malnutrition can result. It is important to seek medical attention for persistent or severe stomach pain to determine the underlying cause and receive proper treatment to prevent these complications from developing. In addition, untreated stomach pain can also have a significant impact on a person's quality of life. It can interfere with daily activities and make it difficult to perform normal tasks or participate in leisure activities. Chronic digestive problems can also cause anxiety and depression, as people become increasingly worried about the pain and its impact on their lives. Moreover, ignoring the symptoms of stomach pain can also lead to the progression of underlying conditions. For example, a peptic ulcer that is left untreated can lead to more serious complications, such as perforation of the stomach wall, which can be life-threatening. Similarly, untreated infections, such as H. pylori, can lead to the development of stomach cancer. In conclusion, it is important to seek medical attention for persistent or severe stomach pain to determine the underlying cause and receive proper treatment. Early diagnosis and treatment can help prevent the development of more serious health problems and improve a person's quality of life. Don't forget to like and subscribe to the channel.